Pseudomonas aeruginosa. This is a bacteria. The features of this bacteria are it's gram-negative. The difference between gram-negative and gram-positive are many, at least 30 are there. If I tell you in simple one difference, main difference, gram-positive, it has got a thick cell wall made up of peptidoglycans. This is gram-negative, means it has got a thin cell wall. So what is the difference? See that when you give an antibiotic to kill a bacteria, it acts against the cell wall. So it is gram-positive, it's very easy to kill that bacteria. Since this is gram-negative and the cell wall is very thin, it's difficult to kill this bacteria. That is one. The shape of this bacteria is rod-shaped and it needs oxygen for its survival. Now, this is how it looks like. This picture, I'll show you once again, but you can have a look that it is encapsulated and there are small features, hair-like features called pili, and there is a long flagellum tube, and you can see this efflux pump tube. We'll discuss in detail about it. Now, in ENT alone, Pseudomonas, it can produce so many diseases. Suppose it affects the pinna, it is called as perichondritis. When it affects the external auditory canal, otitis externa. In that otitis externa, there is a condition called malignant otitis externa, which is common in patients above the age of 60 in immunocompromised patients. In that patient, Pseudomonas can be seen in 60 to 70% of patient, and from otitis externa it can spread to the base of skull, and the mortality also is high. It can take away the life of a person. Now, when the infection is affecting the middle ear, that is this part, is called as otitis media, and it can form even in mastoid cavities. The other conditions are chronic rhinosinusitis, and there is a condition called cystic fibrosis where it infects the chest, and in tracheostomized patients, in chronic conditions, in chronic inflammation, in chronic infection, Pseudomonas can be one of the causes. So these are the common diseases that it can produce in ENT. So what makes it so dangerous? What makes it so resistant to treatment? Let us see that. Now, like how I mentioned before with the help of a diagram, there are small pili which is seen on the surface of the bacteria. It helps the bacteria to adhere to any surface very easily. And it has got efflux pump in its body. So in itself. So the efflux pump, it helps for multiple drug resistance. And it produces beta-lactamase. So any beta-lactamase, suppose you give any antibiotic according to that, it can easily contract against it. And if you happen to give aminoglycoside group of drugs, then it can produce aminoglycoside modifying enzymes. Not only that, it can produce toxins. This toxin can be endotoxin or it can be exotoxin. And do you know that this has got a special feature that it produces a colony of its own and produces a fortress around itself, so that any body mechanism which goes against it, it cannot enter this colony. That is called as a biofilm. It's famous for that. Then, suppose if there is any other bacteria, say suppose Pseudomonas is in the ear and you have any other bacteria in the ear, it doesn't allow that bacteria to survive. It kills that bacteria. How? It secretes an enzyme called pyocyanin which is toxic to that bacteria. Now last, it activates the body's osteoclasts. This osteoclasts are cells which are seen in bones. And this osteoclast has got features of absorbing bones. Means it destroys bones. It activates this osteoclast. So it is in bone, it leads to bone destruction in short. So because of all these features or characters, it becomes really dangerous. Now, coming to the investigation part. If when it is infecting the ear, you can take a ear swab, or if there is a tissue, you can take the tissue for culture. If it is in the sinus, you have to take a swab that whatever discharges from the sinus, and if it's from the chest infection, we have to take a sputum for culture. Now coming to the treatment, we have to give specific anti-Pseudomonas treatment. Now the problem is, anti-Pseudomonas treatment, oral antibiotics are very less. And I'm not naming any antibiotic because this is patient aging problem. And that particular antibiotic, which is against Pseudomonas, it can be given only above the age of 12 and below the age of 50, because the extremes of age, it has got more side effects. We have only one or few ear drops to contract that. So in short, we have to give only IV antibiotics. So, and even this IV antibiotic, especially if it is ear infection, it is malignant otitis externa, we need to give it for a prolonged period, say maybe 4 months. So we have discussed about Pseudomonas bacteria, why it has become so dangerous, how to diagnose and how to treat it in this video. Thank you so much.